We couldn't fight it anymore. It's a mental, it becomes the family's mental health crisis to have to try and recover what you can, and how much more are you willing to pour into fighting an insurance company with endless resources.
Michigan families say they're going deeper and deeper into debt trying to get the mental health care they need. Those families also say they're tired of having their claims for coverage rejected by their insurance companies. Good evening, I'm Ann Emmerich.
And I'm David Andrews. They've taken their struggle all the way to the state capitol, where a proposal to change the insurance code could make a huge difference. News 10's Riley Connell here in studio now to tell us more. Riley?
Yeah, Ann and David, a group called the Advocates for Mental Health of My Youth spent the last year pushing for this proposal to become a law. One thing it would do, require Michigan insurance companies to cover mental health or substance use disorder treatments when they're medically necessary. Some advocates tell me it could mean saving families tens of thousands of dollars.
I had a suicidal child that needed help. And as a parent, you just do what you have to do. At a point, the money doesn't matter.
That's how Mid-Michigan parent Jennifer M. was feeling by the time she found herself more than $80,000 in debt, trying to pay for her daughter's mental health treatment.
We had multiple attempts. We had multiple ER visits. We had multiple stints at short-term care facilities.
Jennifer decided to file a claim with her insurance provider to have some of those services covered, but was denied.
They deemed it not medically necessary. At that point, I went back to all the doctors that we had seen and gotten written letters from them. I pulled all of her medical records. We submitted all of that to no avail.
Patients and doctors are the ones that should be making the decisions about what care needs to be covered.
Rachel Kashiri Murray has a story just like Jennifer's. So do the dozens of other parents in her organization, Advocates for Mental Health of My Youth. Together, they're pushing for a change to Michigan's insurance code, requiring providers to cover any mental health or substance use treatment that's considered medically necessary.
Somebody who's having a mental health crisis or in the throes of a substance abuse disorder does not have the mental capacity to navigate all of this bureaucratic red tape.
Pushing back against the proposal during testimony given last year, insurance company Blue Cross Blue Shield says it's concerned about the kind of care they might be paying for.
In some cases, this will include unlicensed facilities staffed by unlicensed individuals. These would be halfway houses or sober houses.
It doesn't make sense to me if we don't treat the brain as part of the body when it comes to healthcare.
There are a few other changes written into the proposal, including setting standards for deciding what kinds of treatments are medically necessary. The proposal is still waiting on a vote in the Michigan House of Representatives at some point during their current session. Stay with News 10 to find out the results. David?
All right, Riley.